back to the advisory committee. Without the IRR, we cannot implement the IRR. But then again, let me, dugtong-dugtong siya eh. Ano? Dugtong-dugtong siya. Yeah, that's why. But again, let me emphasize, the law was signed on March 11, 2022. No, the IRR was signed on July 13, 18, 2024. No. So 2 years after, but to this point, 11, it's not yet published. No, the IRR was signed on publication. No, that's what's holding this back. But 2024. I'm really, to be honest, this is a disservice 2 years after, but with disability. To this point, 11, it's not yet published. How can you explain that? No, nobody will understand why a simple publication cannot be implemented. No? You just go to a newspaper outlet, you just publish it. Or you go to the official gazette, which is online, then publish it. Again, bring this up to the secretary because it's, for me, it's unacceptable. And that's why we conducted this oversight hearing. This is actually the first oversight hearing that this committee conducted because we saw that a lot of the laws that we have implemented in the last few years have not yet fully realized. And we were not remiss in inviting the DepEd, inviting the other agencies so that they will be abreast of the importance of the laws that we are crafting. But again, without doing the necessary process, then sayang lang yung batas. No? We cannot fully utilize that.
Which says
So
that
we go back to
the advisory
go back to
council
that,
will recommend the roadmap to the IACC. So pending the creation of the advisory council, we cannot, and pending the convening of the IAC, we have yet to
yes,
release
oo.
the roadmap po.
Because-
But yes, Mr. Chair, we will go back to our LLO and OSEC if we can immediately convene na the council as well as release the invite or the call for our advisory council for the implementation of this law po.
In section 14, letter C, in consultation with the Advisory Committee for Education of Learners with Disabilities, created pursuant to this act, other implementing partners.
I'm assuming you did
stakeholders
not miss the big
formulate
news
and
about
adopt
the first
a national
impeachment.
policy on inclusive education and prepare and regularly update a multi-year roadmap supported by annual work and financial plans for the effective implementation of this act. So in other words, there's an interaction, there's a consultation process with the advisory committee. No? But the interagency council will be the one preparing and reviewing. I think the process there is BLD will formulate it. They will review. The council will review in consultation with the committee, the advisory committee. But we go back to the advisory committee. Without the IRR, we cannot implement the IRR. But then again, let me, dugtong-dugtong siya eh. Ano? Dugtong-dugtong siya. Yeah, that's why. But again, let me emphasize, the law was signed on March 11, 2022. No, the IRR was signed on July 13, 18, 2024. No? So 2 years after, but to this point, it's not yet published. No? So the problem is publication. No? That's what's holding this back. But I'm really, to be honest, this is a disservice to our learners with disabilities. No? A delay of this long is, how can you explain that? No? Nobody will understand why a simple publication cannot be implemented. No? You just go to a newspaper outlet, you just publish it. Or you go to the official gazette, which is online, then publish it. Again, bring this up to the secretary because it's, for me, it's unacceptable. And That's why we conducted this oversight hearing. This is actually the first oversight hearing that this committee conducted, because we saw that a lot of the laws that we have implemented in the last few years have not yet fully realized, and we were not remiss in inviting the DepEd, inviting the other agencies, so that they will be abreast of the importance of the laws that we are crafting. But again, without doing the necessary process, then sayang lang yung batas. No? We cannot fully utilize that. Okay, so we go back to, I guess we go back to that. So what we want to know is, in implementing the law, what are the steps what are the budgetary requirements do we need? And how do we, what is the vision in fully implementing the law? Now, for example, how much do we need for the ILRCs? No, how much do we need for the multidisciplinary roadmap? In the same time, it will be a signal to CHED to promote different courses that will help form the multidisciplinary team, also come up with courses for our special need teachers. So it's all interconnected. So the roadmap is, we envision the roadmap as the Bible for the implementation of this law. So without that Bible, we cannot move forward and have definite targets. So that's the complication of not having that roadmap. Nevertheless, I have some more questions, but I want to hear from our stakeholders here, their comments on the implementation of the law. Ito lang ba may highlight? Okay, because some of our departments and offices who are here have specific responsibilities in the law. So we want to start off with DSWD. Any comments? Because we also included in the law some responsibilities, no? So for the implementation of this, of inclusive education. So any comments?
Good morning, Mr. Chair. The DSWD reaffirms its strong support for the implementation of the RA 11650, also known as the Inclusive Education Act for Learners with Disabilities. And one of the role of the DSWD, as indicated in the Act, is one of which is the provision of social and welfare services for children with disabilities. And the DSWD would like to share the continued efforts to address the needs of children with disabilities through the new project of the DSWD, which is the Cherish Project, Mr. Chair. The target beneficiary of this is the children with disabilities. It is a 12-month initiative running from July 2024 to June 2025, aimed at providing comprehensive social protection for children with disabilities and their families. It targets approximately 89,261 children identified as having disabilities from poor households. The project seeks to enhance and detect the registration of children with disabilities through interagency collaboration, provide a monthly disability allowance of 2,000 to assist families with additional cost, and improve access to essential services such as healthcare, education, and livelihood opportunities. Additionally, this project also focuses on training community volunteers to develop effective home care support and services. That's all, Mr. Chair. Thank you.
Do we have any I know that we have a lot of ayudas, no? Parang uh, lahat na yatang pwedeng ayuda, meron na tayong ayuda. Meron ba tayong any support from the SWD to our learners with disabilities, particularly low income or our coming from poor families, LWDs coming from poor families? Do we have a specific program for them?
That would be the Project Cherish, Mr. Chair. That is for the children with disabilities po. And it's currently on the pilot implementation, Mr. Chair. That is the pilot regions are Puerto Princesa, City of Palawan, San Jose de Buenavista, Antique, and the Santa Cruz of Davao del Sur
So
po.
meron tayo.
Yes
Oh, good.
po.
That's good.
That is the first, Mr. Chair.
Okay, and how do you dispense the support? Do you go through DepEd? What's the mechanism to dispense the support? And is it in the form of cash or in the form of
Yes, Mr. Chair. It's a
okay.
2,000 monthly disability allowance po.
Okay, okay.
Yes po.
These are for learners with disability or
For
persons
children with disabilities,
Okay, okay.
Mr. Chair.
Okay, so how do you dispense that? How do you give the support?
The data, Mr. Chair, will be based on the PRPWD of the DOH, Philippine Registry of Persons with Disabilities po.
Okay.
In coordination with the LGU po, Mr. Chair.
Okay, okay. And how do you give the support? Do you have people? Do you go to the schools, or how do you give the support to the LWDs? Do you know?
Actually, Mr. Chair, it's a different bureau who conducted the pilot implementation. But let me check. Let me check, Mr. Chair.
But that's okay. If later on,
Let me check on that.
yeah, later on when DepEd calls for the interagency coordinating
Yes,
council,
Mr.
of
Chair.
which the SWD is a co-chair, let's integrate that support to
Yes.
this law. No?
Yes,
So
Mr.
that
Chair.
it will be harmonious. Meaning,
Yes po.
for example, those LWDs who are going to our public schools, let's make sure that they are targeted and given support, because
Yes po.
obviously when our learners with disabilities go to school, they have to buy uniform,
Yes,
they have
Mr.
to buy
Chair. Yes.
books, they have to pay for their special support services. No, yung pamasahe lang is already an expense. So let's my message is, let's work with the coordinating council, because that's the whole point, no? So that the students, LWDs going to our school system, are given support by other agencies other than DepEd. Kasi admittedly may mga gastos sila eh. No?
That is
But I'm
noted.
happy to hear that you have Project Cherish
Yes, Mr. Chair.
that is being implemented right now.
Yes, sa pilot regions po.
Okay. And when do you plan that to go nationwide?
Well, after the pilot implementation, Mr. Chair, we'll have a monitoring evaluation, and if this project will be successful, Mr. Chair, this will be conducted po on a national level.
Okay. Thank you for that. Next is the DPWH, and there's also a specific role in the law given to DPWH, in particular the infrastructure support to LWD. So, any comments?
Good morning, everyone. Good morning, Mr. Chair. For the DPWH, as of now, we are on the process of the conduct of audit for the school buildings, and the district engineering offices is submitting the compliant of school buildings po.
Meron na bang nag-umpisa na yung audit?
Yes po.
But we're talking about almost 47,000 schools. So, meaning your engineering districts will conduct audit on all of these schools?
Yes po, the District Engineering Office is the one who conducted the compliance of the school buildings.
Have you started the audit of the schools? For example, ramps, railings. Have you conducted those?
Yes po.
Meron na? Do you have
Yes
any?
po.
Do you have a report?
As of now, we are still awaiting for the submission of the District Engineering Office.
Sige, can you?
Maybe this year, end of this year.
Yeah, it's good to hear that you have started the audit, and just submit to the coordinating council and also to this committee a copy of that audit so we can help you with budgeting. We can also help DPWH in pushing for those infrastructure requirements for learners with disabilities.
Yes, Mr. Chair.
Thank you for that. Next will be DOH. Any?
Good morning.
Yeah, go ahead, ma'am.
Good morning, Mr. Chair. The Department of Health fully support this RA 11650. As of today, sir, we are coming from 4 offices, sir, which is we are all part in the RA 11650. Just to name is one is the disability program, one is the oral health program from our health promotion bureau, and also a touch agency from the National Nutrition Council. Please allow us, sir, to share with you
Yes, go ahead, ma'am.
per offices, sir. The passage of RA 11223, also known the Universal Health Care Act, further guarantees that all individuals, including those with disabilities, have access to quality health services without financial hardship. The Act's provision aligned with the 8-point agenda as the health sector's medium-term strategy to achieve universal health coverage, improve health outcomes, and strengthen health systems. Recognizing the growing concerns of persons with disabilities, various laws and policies have been developed to enhance the quality of life for these individuals. RA 7277, or the Magna Carta for Persons with Disabilities, provides rights and privileges for persons with disabilities, promoting their integration into mainstream. Further, supporting this RA 7277, the Department of Health issued an order, the revised national policy on strengthening the health and wellness program for persons with disabilities, which aims to establish an effective national health program for this group. So the implementation also, as mentioned earlier, the implementation of the Philippine Registry for Persons with Disabilities was developed in collaboration with the National Council on Disability Affairs Office that further strengthens these efforts by systematically identifying and supporting individuals with disabilities. The PRPWD is a registration system where data such as general information, types, and causes of disabilities are captured. And aside from being a registry, the system also designed to assign a unique identification number for persons with disabilities to enable them to avail of discounts and other benefits. As of now, Mr. Chair, as of November 9, encoded or registered in the Philippine Registry for Persons with Disabilities, the total of 1.8 million persons with disabilities, including already children with disabilities, sir. And learners with disabilities can avail of services for persons with disabilities by applying for a person with disability identification card. Hence, learners with disabilities are encouraged to apply for a person with disability ID card, provided that they can submit the required documents to be recognized and receive services provided for persons with disabilities. As of now, we have 10 categories or 10 types of disabilities registered in the system po. Currently po, the Department of Health is also enhancing the type of disability by developing a standardized definition and categorization of disability in the Philippines. So at this time, we will have 9 categories of disabilities, namely hearing disability, intellectual, learning, mental, physical, speech, language, and communication disability, visual disability, cancer, and rare diseases. So the objective of these guidelines is to generate disability definition that will be understood by all stakeholders and utilized in assessing and providing health and rehabilitation services for persons with disabilities at all levels of healthcare in the Philippines. The DOH also planned to develop a manual of operation and training modules for this categorization of disabilities by next year to ensure the timely quality assessment and categorization at all levels of care in the country. Moreover, the DOH implements the Magna Carta for disabled persons with disabilities to provide a 20% discount and value-added tax exemption upon purchasing health-related products such as medicines and medical devices and the availability of health services. And lastly, to ensure financial risk protection, the Philippine Health Insurance Corporation provides health benefits and rehabilitation packages for persons with disabilities, specifically for children with disabilities. This includes the rehabilitation packages for those with hearing, visual, mobility impairment, and developmental disability. So, Mr. Chair, can you also share with other programs that are present here to share also their initiatives from the Department of Health?
Yeah, go ahead.
Thank you.
Go ahead. Who's?
Good morning, Mr. Chair. Good morning, everyone. For Health Promotion Bureau, sir, we have incorporated in our implementation of the Healthy Learning Institutions program some aspects of ILRC. So HLI, sir, Healthy Learning Institutions, it's mandated by the Universal Healthcare Act. It's a program, it's a multisectoral program aimed at promoting the health and well-being of both learners and school health personnel. And since our pilot implementation in 2022, sir, and 2023, and our implementation last year, this year's current year, we have incorporated, sir, indicators on ILRC. So what we do, sir, is we provide materials to elementary schools and that are related to ILRC, including inclusivity and well-being materials for schools. And we also have our regional offices helping us in implementing HLI program together with ILRC, sir. So as of this year, sir, we have a total of 1,500 elementary schools that are within the program. And in implementing our initiatives, sir, in these schools, we have already incorporated ILRC indicators, sir. Over. Thank you.
Thank you. Thank you for that. Any go ahead.
Yes. Hello. Good morning, Mr. Chair, and members of the committee. So I wish to read to the body the position paper of the NNC, or the National Nutrition Council. So the National Nutrition Council is the highest policy making and coordinating body on nutrition in the Philippines, and as a key partner supports in implementing the RA 11650. So emphasizing how nutritional well-being is integral to the success of inclusive education programs. The NNC poses also, we strongly integrate for the integration of the nutrition into inclusive education. We strongly advocate for the integration of the National Nutrition Council into the implementation framework of RA 11650 for the following reasons. Number one, we have the nutrition as a foundation for learning development. Research has indicated that undernourished kids are more prone to experience social and academic difficulties. Children with special needs and disabilities already work harder than their counterparts just to accomplish everyday tasks. Obesity, on the other hand, adds an additional layer of difficulty of both children and their caretakers. So furthermore, the study of Bonder in 2024 states that children with disabilities are twice as likely to have overweight and obesity than other typically developing peers. So higher weights in this individual may compound challenges already experienced in their disability, including mobility and activities of daily living. So by addressing the dietary requirements of learners with disabilities, the NNC's experience developing and enforcing nutrition rules, such as nutrition guidelines for Filipinos, among others, that would enhance RA 11650's instructional focus. Second, comprehensive support for learners and disabilities, because learners with disabilities frequently encounter complicated issues that go beyond schooling, and the law's inclusive mission necessitates a multi-sectoral approach. Third, capacity building for schools and communities. The NNC has extensive experience in community-based programs and capacity building initiatives. So this expertise can be transferred to capacitating our school health personnel in DepEd, our teachers and local government units, health personnel in integrating nutrition interventions into inclusive education programs. As an implementing agency as well, NNC can aid in the development, implementation, and evaluation of the school-based feeding program tailored to the specific needs of the learners with disabilities and promote awareness among parents and communities about the importance of nutrition in supporting inclusive education. Fourth, alignment with existing national and global goals. The inclusion of the NNC in implementing RA 11650 aligns with the following: the Philippine Development Plan 2023 to 2028, emphasizing health and education as pillars for sustainable development. The Philippine Plan of Action for Nutrition in 2023 to 2028, the PPAN's desired vision of change, decrease in all forms of malnutrition across age groups by 2028, particularly in its commitment to improve access to quality services, where NNC emphasizes the Filipinos' benefits from well-coordinated, inclusive, and integrated quality nutrition and related services. And United Nations Sustainable Development Goals, SDG, particularly SDG 4, the quality education, and SDG 2, zero hunger. So by ensuring that nutrition is integrated into education policies, the Philippines takes a holistic approach to fulfilling its commitments to both national and international development goals. Our recommendations to operationalize this partnership, we recommend the following. First, the institutionalization of NNC representation in implementation bodies to ensure the NNC is represented in the interagency committee overseeing RA 11650 to align nutrition policies with inclusive education programs. Second, specialized nutritional needs, where learners with disabilities have specific dietary requirements. The NNC can guide schools by collaborating with DepEd and local government units to design appropriate feeding programs and design social behavioral change communication for nutrition education that addresses the specific needs of learners with disabilities. And also the conduct of research and data collection. We can set direction on the type of researches that our partners to prioritize. And community awareness, where to conduct campaigns to highlight the importance of nutrition in achieving inclusive education, such as NNC's NutriSkwela, among others. And to promote understanding of the link between nutrition and inclusive education through national and local advocacy efforts. In conclusion, the participation of the National Nutrition Council is essential to accomplishing the goals of RA 11650 by attending to the dietary requirements of the students with disabilities. We guarantee their overall growth and fair access to high-quality education, promoting a more inclusive and health-conscious community. So that would be all, Mr. Chair. However, this position paper is still to be signed by our Executive Director, Azucena Dayanghirang.
Thank you for that. Yes, go
Sir,
ahead. Mr.
we have
Raimundo.
additional from the Oral Health Services, the Division Chief, Dr. Noel Ballesteros.
All right, good.
And perhaps, sir, in future meetings, other programs mentioned in the law will also share their initiative from their program, sir.
Okay.
But at this time, we have still the Oral Division, sir.
All
Thank
right.
you.
Good morning, Mr. Chair. I would just like to announce the PhilHealth benefit package for oral health has already been approved. So ito po yung routine preventive oral care. So ang ibig sabihin po nito, libre na ang pagpapalinis ng ngipin, tsaka magkakaroon din ng fluoride application, tsaka sealants sa mga accredited consulta providers. So napakahalaga nito lalo na sa mga children with disabilities, learners with disabilities, dahil preventable naman talaga ang pagkasira ng ipin. And sad to say, Philippines has one of the highest caries prevalence in the world. So kung ma-avail na mga bata at lahat ng matatanda ang itong routine preventive care, may iwasan na ho yung pagkasira ng ipin from the first 1,000 days up to the last 1,000 days. Kaya sinasabi, siguro appeal ko na rin sa Department of Education kasi may mga dental clinics po kayo. So maganda sana na maipakredit ito sa PhilHealth para yung mga dentista, gagamitin ho nila itong mga serbisyo, iikot na ho ang pera para ma-serve nila ng mabuti ang mga learners with disabilities at ma-prevent na yung kanilang pagkasira ng ipin dahil ang ngipin ho or oral health is very essential to good nutrition and overall health.
Thank you to DOH. I have a basic question. In the law, the responsibilities of DOH to provide learners with disabilities with healthcare needs, services such as child mental health services, health plans, health care, and family-to-family health information and education. How do you plan to bring this down, to our schools? Because how do you roll this out to our schools? Because like I said, the vision here is to have 1,600 plus ILRCs. On top of that, earlier the DepEd mentioned that some of our schools also have special needs classrooms. So how do you reach our learners with disabilities on the ground? Because we're talking about 300 plus thousand. No? How do you provide them with all of these health services? It's good that we have the services. I'm very happy to hear that the DOH have these programs and services just like the SWD. But the battleground kasi is to the learner on the ground.
I'm assuming you did not miss the big news about
Kasi
the first.
nagkaroon po kami ng joint joint administrative order, ang DILG, ang DepEd at saka ang DOH para ma-harmonize po yung pag-deliver ng serbisyo. So importante rin po kasi lalo na sa LGU level, we have the policies but actually the implementation, like yung ita-track down kung sino yung mga learners with disabilities. We need to coordinate with the Department of Education and also the LGU, yung master listing. Sir, kasi all of these services are available naman eh. And may services talaga kaming plano, like yung sa mental health, yung heads, and then may iron and folic acid supplementation, may immunization, HPV, pati yung measles, rubella. Kaya lang, we need to harmonize our efforts para talagang ma-deliver sila sa mga learners with disabilities.
And in addition, sir, we have the regional offices ng DOH that also connecting directly to the local government unit. So as mentioned by Dr. Noel, we're working together from the national, from our regional to local, sir, for the implementation of our programs, especially as we mentioned for the benefits po the children with disabilities or learners with disabilities po.
That's the whole reason why we created that interagency coordinating council, is to really harmonize the program and also the delivery. I want to emphasize on the delivery because the programs are good in paper, but if you don't deliver that to our learners with disabilities, they'll kalat sila eh. They're all over the country. It's sayang lang, no? Because they're not taking advantage of those programs. These are very good programs. It's just the delivery will be the challenge, and that's why we created in the law the Interagency Coordinating Council, so that all of these programs, DepEd will be abreast, and DepEd can mobilize kasi they have the machinery. Eh. DepEd is, they have 47,000 schools, they have teachers. They can bring down the programs to the school level, no? All the way to the school level. No? So that's why I'm happy to hear, no? There are programs. Once the Interagency Council has been created, please, whether you're focal person or whoever you assign, please be active with that Interagency Council. All right. Next will be Dole. the Department of Labor.
Good morning, Mr. Chair. Good morning, everyone.